Right. So if you have read and understood, considering the clinical examination station, kindly begin.
Yes, ma'am. I would want to wash my hands and
Yes.
introduce myself to the patient and also confirm his age, his name and date of birth.
Yes.
So once I've done that, then I would want to I would want to explain to him what I want to do, which
Yes.
is I want to examine his knee, his knee, and I would do this by watching him walk. I would have to look at both knees, and also I will feel, and I would also assess some movements, which will be done actively by him, and also I would assist him in doing some passively. Then I would want to ask him if he's okay with this and obtain a verbal consent.
Yes.
Once he
And
gives me a go ahead, then I would want to expose him. The exposure is just for him to be on his boxer shorts, which will
good.
be okay for me.
Yes. Yes.
My examination will start by him standing. I would want to inspect I will inspect him from the front, from the side, and also behind. What I'll be
Yes.
looking for, I'll be looking at if there's any asymmetry in the limbs, in the knee. For this particular patient, the right knee is swollen, so there will be some asymmetry. And I also want to look at the bulk of the muscles, the quadriceps, the glute, that's when I'm looking at him anteriorly. I'll look at all the bulk of the muscles, both from the thigh and the legs. And I would also look at him from the side. I want to see if there's any form of abnormal flexion, I'll look at the patella and also look at the ankle. Then posteriorly, I want to look at the, assess the gluteal bulk a bit, though he's still on his shorts. Then I'll also look at all his muscles posteriorly. Once I've done this, yes, then I want to observe his gait. He's having difficulty to walk, but I'll try to convince him just for him to walk. Once he walks, I would observe his gait. He would be having an antalgic gait. I would offer a support while he's walking. So once I've observed his gait, I would want to explain to him if he's still in pain and would want me to give him some analgesia. I would want to offer him some to get the nurse to give him. The next series of examination will be done while he's lying supine. Firstly, I would explain to him what I want to do. I would have to touch him now, and I also want to know if he's feeling any pain or any form of discomfort, he should let me know. I'll be gentle, and I would also stop if he's in any form of discomfort. So firstly, I would want to check the temperature of both limbs, starting from the thighs bilaterally downwards. I expect the right knee to be warm to touch because it has a swelling on the right knee. So once I've done that, I'll fix my gaze at him and look at if there's any form of grimace to test for tenderness, to assess tenderness in him, which I expect him to have because of the right knee pain and swelling. So once I've done that, then I would ask him to make some movements. That will be the active movements. I'll tell him to flex. I'll start with the normal limb for all my examinations. So because I might have a lot of difficulty carrying out movements on the affected limb due to the pain he's having. So I would start with the left knee. I'll tell him to flex as much as possible. I expect him to flex as much as 120 degrees. Then I'll also tell him to extend the knee fully. Then I would offer assistance to carry out passive movements to ensure I can assess the range of movement and also watch out if there's any form of crepitus and stiffness of the joints. So I'll do this starting with the left knee and also end with the right knee. Then I would want to use this opportunity also. I'll tell him to flex the knee and I would assess the pulses. That's the popliteal pulse. Once I assess the popliteal pulse bilaterally, then I also assess the posterior tibial and the dorsalis pedis, however, not so important. So once I've done that, then I would want to assess if there's any form of collection in the knee joint, if there's any effusion. So I would do the Patella Tap Test. The Patella Tap Test, I would stroke from above and below the knee. Once I get to the suprapatellar pouch, then I'll use my thumb to tap on the patella if there's any floating of the patella. Then I could also do the bulge test. The bulge is I will stroke medially and then laterally to see if there's any bulge. So I would use this to assess if there's any form of effusion or in the knee, which I expect, which you might have on the ipsilateral, the affected knee. Once I've done this, then I would explain to him that I'll be carrying out some tests, some specific tests to actually hit my diagnosis. I'll start with I'll start with the anterior and the post. First of all, I'll tell him to flex and I'll look from the side. I'll look from the side to see if there's any posterior sag sign, which he could have if there's posterior cruciate ligament injury, displacement of the tibia relative to the distal femur. Then I'll do the anterior and the posterior drawer test. These are to help. The anterior drawer is for anterior cruciate ligament. The posterior drawer is for the posterior cruciate ligament, which will be displacement of the tibia respectively. Anteriorly for anterior cruciate, posteriorly for posterior cruciate. Then I would also want to do a Latchman test.
Can you present your test now? Yes.
So, yes. I've examined a 21-year-old professional footballer that presents with right knee pain and swelling. My findings were he has an antalgic gait with the right knee being affected. There's significant asymmetry of both knees. The right knee is swollen, and the anterior drawer test is positive. And also I could, however, both pulses I could palpate the pulses on both limbs. So I feel he has an anterior cruciate ligament injury, and he could also not perform a lot of movements because of the pain in the right knee. So I think he has a right anterior cruciate ligament injury.
Right. How would you confirm your diagnosis?
I'll confirm my diagnosis by doing an MRI, a magnetic resonance imaging of the right knee.
All right. What should be the management options available for this patient?
Yes, the management options include that would be first of all, I would want to rest the knee. I would immobilize the knee and also offer some form of compression and also elevate, which will help to reduce the swelling, and also I'll give him some analgesics. We would benefit from an arthroscopy and ligament and an arthroscopic form of repair of the ligament.
Okay. After how long would the patient be? Yes. After how long would the patient be fit to play again?
It will be fit to play minimum of it will take about 6 to 9 months to recover from the injury.
9 months. So for how long would you rehabilitate the patient?
Yes, I'll rehabilitate him for the same duration of time, but he should be able to play after 1 year.
Between 9 to 12 months.
Yes.
Okay, good. Thank you. Yes, some of the things, it was very good, this examination. Some of the things, when you were doing the palpation and you felt for temperature and tenderness, you could have taken the quadriceps circumference as well.
Yes, I forgot.
And then I think you mentioned at the end pulses, but when you were explaining, I don't remember, you took the popliteal and popliteal fossa. You checked the popliteal fossa for the muscles.
Yes, ma'am.
Yeah, that is something you missed or forgot. Okay, and then at the end, once you couldn't complete the examination, so you could have mentioned that if time would have allowed you, you would have completed with the remaining, because McMurray test and Lachman's and all those.
McMurray and the Barros and Vargas test.
Yes. Yes.
And I was explaining the latchmans already, but I couldn't
Yes,
finish.
but you couldn't.
And I would
but
also
then
want
you,
to examine
yeah.
the joints.
And then to complete your examination, you had to tell me that you will do the hip and the ankle examination and the complete neurovascular examination of the lower limb. Yes, this is important. Good.
Yes,
thank you.
Thank you, ma.
Thank you. Timer is here, and here is your question.